Welcome to Teal Talk, a podcast brought to you by the Ohio Alliance to End Sexual Violence. That's OAESV for short. We're your hosts, Taylor
and Lori.
In each episode, we speak with professionals in the field to dive deep into the intersectional issues that affect survivors in Ohio.
Before we begin, we want to give a content warning that we will be discussing sexual violence and other issues that may be upsetting and triggering. If you need help, please feel free to call our resource line at 888-886-8388 during regular business hours, or the Ohio Sexual Violence Helpline 24/7 at 844-644-6435. Please take care of yourself. Hello, and welcome back to Teal Talk. My name is Lori, and I am your host. I am joined with my co-host, Taylor Ucker-Lauderman, and today we are diving into a topic that impacts every single rape crisis center in our state: data. While it might not sound glamorous, the way we collect, manage, and share data has a huge impact on how survivors are served, how resources are allocated, and how systems respond. We're joined by Jen, a fellow OAESV staff member, as well as Deja and Lex from UBUNTU, a phenomenal agency we've partnered with to lead a critical project transforming Ohio's fragmented, funder-focused data landscape into a more unified and survivor-centered system. If you attended last year's OAESV annual conference, you may have already gotten a sneak peek into the groundwork of this project. I presented a workshop where I shared findings from my capstone project. So my master's is in public health, and for my final graduation project, I compared reporting systems across the nation to assess challenges and ways to increase uniformity and consistency of reporting in Ohio and beyond, specifically sexual violence reporting. So my capstone project laid the groundwork for what is to come in this episode. Let's get into it. All right. Well, hello, everyone. Thank you so much for joining. We have a full house in the podcast studio today. Let's just kick off with having Deja and Lex tell us a little bit about Ubuntu and your approach to this work. I'd love to hear how you got involved with this data collection project, and then we can have Jen pop in and also share how data has become such a big part of their role.
Yes. Well, thank you, Lori. So we are a Black and undisciplined learning community based in Milwaukee, Wisconsin. And so when we say undisciplined, we're really just talking about we all come from different academic discipline. And so when folks hear research and evaluation, I feel like they have a very particular vision of what that looks like, but we have folks who are coming from education, marketing communications, urban planning, social work, and we kind of use all of those lived experiences and academic disciplines to inform how we approach research and evaluation. Really specifically, we don't intentionally consider ourselves like a consulting firm, and we say that we're a learning organization because we want to make sure that our partnerships with the people we work with is genuine. And so like we are kind of going through this learning journey with clients, and it's not like we're only being seen as like the experts in the room or the folks who need to be consulted with. And so that's why we intentionally refer to ourselves as a learning community. Our name Ubuntu, we get this question a lot. What does Ubuntu mean? It's a Bantu term that means I am because we are. And so I think that really just reflects on our approach to evaluation and research, and just recognizing how interconnected we are to each other, and as well as like the interconnectedness of knowledge and growth. We provide facilitation, evaluation, strategic planning services, and much, much more. Really with the vision of how can we transform how folks think about data, how folks think about research and evaluation to build towards a more liberated world. So that's just a little bit about like who Ubuntu is. I think the question about like our involvement with OAESV is really interesting. I know personally the project resonated with me, having spent years working within a domestic violence organization in Milwaukee, Wisconsin as a program coordinator and an advocate. So I understood some of like the tensions around data requirements and survivor-centered approaches. It kind of merges both of my worlds together. And so that's just a little bit about why I was really excited about this project. And I'll pass it to Lex.
I'm Lex. I am an associate evaluation strategist here at Ubuntu. Just made 1 year in April.
Woo-hoo.
We like to call ourselves an adult Montessori. So we're learning, we're growing, we are undisciplined, but we bring all of those frameworks to the work. So being on the project with OAESV, I came from direct services, so I had that approach to the work, and it was important to see like what statewide initiatives were developing and how to get those voices uplifted from a direct service perspective. And then also bridging that with evaluation strategy and seeing all those things come together into life felt really empowering. It's always super funny seeing how projects start with like, this is our initial scope of work, and seeing how it emerged into this beautiful piece of collaborative work. So I feel like it's so much more than just evaluation and strategy. It's almost like world building in a way.
Yeah, I would also love to hear a little bit from Jen because it's her podcast debut.
Yeah.
Jen! Yeah, I would love, Jen, if you could take us through a little bit of your perspective on this project. What was the scope of the project and how were you involved in connecting with Ubuntu?
Yeah, great question. True, it is my podcast debut as well as Deja and Lex. So I'm excited to be here with y'all. Hi, everyone. My name's Jen Ida Miller. I'm a staff member at the Ohio Alliance to End Sexual Violence. So my role is kind of a combination of supporting with grants management, supporting with data management, and also some communications and resource work as well. This project is a continuation of the great work that Lori has done through her capstone and her Master's of Public Health work. We collect a lot of great data here at the coalition internally about what coalition work we do, how we're trying to build capacity and infrastructure in Ohio, supporting rape crisis centers. And we have started to look at there is a larger need to collect and do more external data collection, working with communities, working with rape crisis centers, because sexual violence data is not very well talked about for Ohio specifically. There's a lot of estimates. And we would love to figure out a way to uplift sexual violence specific data storytelling for Ohio specifically. We say that sometimes sexual violence is coinciding with other experiences of violence. So sometimes sexual violence is just left out of data projects, left out of storytelling. And so finding a way to uplift sexual violence in a way that feels like we're trying something new, it's very explorative, has been really great. So in a continuation of Lori's work, we've been looking at how can we in Ohio create a statewide data collection process to start to capture experiences of sexual violence in Ohio, to uplift them. And that's been a huge process. So we shared an RFP and interviewed a few different organizations. I'm really grateful that we've been able to work with Ubuntu because truly they've been very collaborative, very emergent, very flexible, very supportive. It really does feel like we're in a learning community together. And they do understand and want to center survivors' voices. And that's been incredible. As we started this project, truly the first questions were, should we create a data collection system or project for sexual violence here in Ohio? And if we should, how should we approach it? Should OASV be the organization that holds it? And so that was kind of the first part. And so we worked with Ubuntu to do listening sessions around the state, connecting with survivors, connecting with rape crisis centers, state stakeholders, and state administrators to ask those questions. Do we need this? What do we want it to look like? Should OASV have this project or not? So that was really helpful to really explore the needs, the approach. And then the second part of the project we're in now is After hearing a lot of yeses and excitement and needs for this, we're exploring how can we build capacity for rape crisis centers and providers to better capture more accurate, more holistic data on sexual violence services, and then how can we truly start to capture that data and share it back with Ohio communities, Ohio service providers, rather than it going somewhere and not being available for the communities that it's being collected by and for. So yeah, it's still very much in process. There's been a lot that we've learned along the way. I'm really excited that we can do some more external data projects and uplifting news stories as well.
Awesome. Thank you. Jen, you started talking a little bit about some of the challenges that we've noticed. What do you all see as the biggest challenges with how sexual violence is collected and reported in Ohio?
I can jump in and then pass it. Geographical context is so important, and understanding how each state navigates sexual violence, like data collection and what does that look like, looks different. And so one of the first things that the project team at Ubuntu did was like a literature review, specifically on the capstone report that Lori created around what would the development, implementation, and operation of like this state level database system would look like. And so I think one of the things that was really evident in like the research, both with the literature review and also with talking with different stakeholders such as survivors and staff at rape crisis centers, was that overall, the data collection process is very inconsistent and fragmented amongst different orgs and throughout the state. And so you have a variety of ways that folks are collecting this data. So it could look like paper forms as far as like when people are seeking services and seeking support. It can look like folks who actually have a current database system that they're using to track their client data. And so when you have so many different variety, it does become very difficult when you are trying to get a comprehensive understanding of what are the trends of sexual violence in Ohio, because there are so many different methods that things are being collected. So that was one of the main things that I saw within our, engagement with community in Ohio.
Yeah, definitely. I would say additionally, there are so many different avenues for people who have experienced sexual violence or sexual assault to disclose. And there's not necessarily a mechanism to capture that that's holistic, that's survivor centered, that is across the board for the state of Ohio. I'd love for us maybe in 5 or 10 years to do a population level survey where we can just ask directly across the state people's varied experiences. We know that communities have different language to describe sexual violence, different ways of noting that within their family lineages, right? Not everyone says sexual assault. In my family, we talk about, yeah, there was that bad man. We don't say the word voyeurism. We say, they were looking. There's a lot of different nuanced ways where we can capture that storytelling. We don't always have to define it the same way. We don't always have to collect it in the same way. So I think that is a challenge. Sexual violence is such a immersive community level experience, lineage, family level experience, and individual level experience. It's just inherently difficult to capture in a way that's really holistic, that's really meaningful and trauma informed. And I think one of the challenges I experience in this field is, as our field is professionalized over time, the 80s and 90s getting federal funding, a lot of the data collection has shifted in priority to collecting law enforcement data, to collecting data to support federal funding. There's a lot of important conversations in the field and movement about the pros and cons of this. There's an increase of funding to support the work, and also it inherently makes the work more restrictive. So we know that there is some sexual violence data in Ohio, particularly around people that report to law enforcement. And then law enforcement agencies can voluntarily share that with state agencies. But what I find really frustrating is we know that the vast majority of survivors don't report to law enforcement. And that's not holistic data. I didn't report to law enforcement. I know a lot of survivors who haven't. So I know we're really excited about figuring out ways to capture more holistic data. We know that many survivors can and do go to rape crisis centers, but not all survivors, right? So we're looking at what are ways that we can capture more representative data about not just what experiences people have had and how and when they've disclosed sexual violence, but also what services were they wanting, what services were helpful for them, something that's more holistic and not just rooted in the criminal legal system or in law enforcement systems. It's truly what are people in Ohio experiencing, what services are helpful, one, so we can better affirm to survivors that they're not alone, and then two, hope to improve community-based rape crisis center services and not just law enforcement or criminal legal system, something more holistic and better capturing truly the needs of Ohioans.
Yeah. Yeah. And I would say Deja and Jen captured that perfectly. Like you said, we started off doing a literature review of Lori's white paper and other contexts too that really outlined a lot of the inconsistencies in data gaps in reporting and reporting requirement. That helped us kind of identify who were going to be our collaborators, who were the people that we needed to center in this project, which were staff at rape crisis centers, survivors, also state funders, and different state agencies that do funding. Through that, we were able to uncover a lot of the storytelling behind those three different perspectives of how to make this system more unified and centralized. And a lot of what I got from that was staffing limitations. Like, they're in the field, they're doing this work. They don't necessarily have time to note take every detail, but then that can impact the way services are relayed to funders, and that could create gaps in different regions of the state. So a lot of the state agencies and funders we talked to, they were like, well, we just don't have enough information to upskill the services that we provide. Like, we need the data to support why we're funding a thing. There was a consensus that we trust OASV as a coalition to hold this system. It was all these different perspectives that we were able to uncover, and that eventually led to our recommendations to, like, dignify the experience for everybody involved, because we're hearing so many perspectives that are overlapping but can also conflict in a way, because we're requiring this thing, but how do we capture all of the needs of everybody involved?
Yeah, that's huge. OASV was just able to do some in-person visits around the state with all of the rape crisis centers, and that was really helpful for us to see and affirm there's so much need for sexual assault services in Ohio, and some of these programs are very small and they are doing a lot with the funding, the resources, and capacity they have. It's truly astonishing to me. Through this project where we were doing really intentional listening sessions with folks, that just further affirmed that we as the coalition, like, our role can and should be to continue to resource and continue to increase capacity at local rape crisis centers, one, for more staff capacity, but two, any way we can to help them do their work in a way that they can also be focusing on crisis intervention, prevention, services, and then also data collection as they can. So I think that really informed our next steps of we need to pour as much resource and support into local programs to help them continue to do data collection that is survivor centered, so that we can then create a resource for Ohio that shows sexual assault services in Ohio that's being offered, the number of survivors receiving care, especially because that number is a lot higher than other kind of systems-based reporting we see. So we're getting closer to seeing trends of who's experiencing sexual violence and who's receiving services in Ohio. So I'm excited about that process. I'm excited that we can truly take the feedback of local programs and survivors to identify the questions and the data points we're collecting for a community-based report. And it's not for a funding stream or for a particular system. It's more focused on what we hope Ohioans to see, and which will help service providers improve their services as well.
I'm really grateful that you all brought up the importance of shifting from a funder-driven model to one that's survivor-centered, one that's led by survivor needs. And one thing we actually did is connect with our Survivor Empowerment and Advisory Council and get real survivor feedback on the types of questions we were going to be asking at the listening sessions and getting their feedback, because the lack of data affects real people. And I think when you're sitting down and you have the data hat on and you're thinking, like, who are our stakeholders? It's sadly really easy to forget that survivors are a huge stakeholder in a project like this. And I'm wondering if you could talk a little bit about how we can ensure that survivor voices don't get lost while also maintaining consistent data. You know, we don't want to lose like the unique needs or voices of individual communities, but we also don't want to have data gaps.
Mm-hmm. Exactly. I think the biggest thing, and I think we had to do this like as an overall team when we were trying to figure out like who should all be involved in our focus groups or interviews, like whose voices should be at the table to really inform the information that we will use to provide recommendations to OAESV. And one of the things that we didn't want to miss is like the end user. So like when you're thinking about a database, a lot of times the end users from some lens could be like the staff or the advocates who are going to be using the database, who are going to be inputting like data into it. And so taking like a step further is like, okay, the information that they're going to be putting into this system, whichever one that we recommend at the end of the needs assessment, is going to be survivor information, survivor stories, survivor data. And so I think it was a shift of the questions around like, okay, what does the database need to look like? What do different funders require to be collected, to really about how can data collection enhance survivor healing, autonomy, agency, while also like protecting privacy and like really uplifting dignity. And so I know like myself and Lex have mentioned dignity like a lot during this talk, and that's because a lot of like Ubuntu's approaches to the work is dignity based. And so we're always thinking about like, what if we started with asking survivors what data matters to them? Or like, how does a dignified experience look like when you do go to an agency to report an incident that happened? And I think that shift of like being survivor centered really makes sure that whatever we're recommending, whatever we're collecting, is centered around the folks who are closest to the work, to make sure that their voices don't get overlooked or just not prioritized. And another thing that I want to uplift is that through the engagement with focus groups and one-on-one interviews, is that some survivors were very vulnerable in expressing how sometimes the data collection process is re-traumatizing. And so one thing that was really uplifted is that a lot of programs offer different support services or they do referrals to other organizations. How can we minimize redundancy in data collection so survivors don't have to repeatedly share their trauma or narrative for administrative purposes because they're getting referred to different programs or different organizations and things like that? And so, what does it look like to have a system where a survivor can report what's happened and then not have to be re traumatized through the name of like, okay, we need this data in order to report back to our funders. We need this data in order to show what impact we have. And we understand that that is very important. Narrative building is very, very important for organizations, but also wanted to think about, okay, how does it feel for the person who's sitting with the advocate, who's going through like that onboarding process, and what does it look like to dignify that data collection process? So I think that was one of the things that was uncovered during our engagement as well.
Yeah, agreed. A lot of focus on and valid concerns about how the data is protected, how it's kept confidential. I know something OASV continues to explore is how we could advocate for additional layers of privilege for advocates in Ohio. And also, yeah, recognizing that data collection process can inherently be extractive in many ways. So continuing to support advocates and service providers in training on only collecting information that survivors want to share and want to be documented, knowing the limitations of how that data can and should be kept confidential. Those are really important conversations.
That question is always so funny to me because we're always practicing that. So sometimes it seems like a no brainer to me that, oh, of course, we're going to center survivors in this work. Who else? At Ubuntu, we're going to be community driven. We don't consider ourselves the experts in our recommendations. We just consider ourselves like the translators. Like we're just translating information to people with power and influence. We're all experiencing these things, but we just don't always have the influence or power to do anything about it. So how do we bridge that gap?
That's just one of the reasons I think why we're grateful to be working with you all and to have built this relationship. It feels really good to align in those ways and for it to just be a given and not even be something we have to say, wait a second, don't forget about that real end user. Deja had mentioned we kind of have to push sometimes to that real end user, that we have to like maybe have that reminder that the actual people that we're looking to help and impact are still those survivors. But could you all help the listeners to understand how would this work? These numbers, these things that seem so far away from people. How will this work ultimately benefit survivors and advocates and just the broader movement?
One of the things that through this project and like through the work that like we do is like really look at systems level change and like systems transformation. And so I think one of the things and why our approach is so intentional is because we're really looking at, okay, how can we transform the narrative and the thought process around data collection, whereas it's not just about maintaining compliance, but it's about how can we use the information that we're gathering to understand patterns that is happening within Ohio when it comes to sexual violence. How can we uncover gaps in services, gaps in support, and then what does it look like to drive positive policy change? And so one of the things that like I always use to kind of ground in how I'm seeing things is through Dr. Crimbley Crenshaw, who coined the term intersectionality, that like you cannot solve a problem if you cannot name the problem. And so I think within the field of sexual violence, right, I think we all have an understanding that this is a problem that is happening within communities.
Mm-hmm.
Yes, like we can understand some of the estimated numbers and things like that, but what does it really look like to combine both the quantitative, so like the numbers, the statistics, with the actual stories of survivors and merge that together? And so, like, one of the questions that we asked in this project is how can we make sure that this data that's being collected doesn't just sit in a system that then just gets compiled when certain funding reports are being due and things like that. But how can we use the data that's being collected to actively inform better support for survivors, better like communication within the ecosystem of rape crisis centers or different organizations who are around anti-violence? And so I think we're moving from, okay, what are the numbers saying? What are the numbers saying, to really see like, okay, what are the stories that survivors are telling us? How can we use the patterns and the information that we're gathering, and how does that contribute to systemic change? Like how does it contribute to better services? How does it contribute to conversations just happening so people are aware of what's going on in Ohio? And it's not just with folks who work in this particular field, but no, everyone understands that this is a issue that requires my attention, my awareness, and my advocacy. And I think that because we're survivor centered, it creates that kind of like domino effect where we're increasing the level of trust in the system in order to provide more comprehensive and accurate data. And because of that, we're able to better inform policy advocacy while having a unified voice. So it's not just rape crisis center directors advocating, it's not just a coalition advocating, it's everyone advocating within the community, because we know that this impacts all of us, regardless of if you work in the field or not. I think that's one of the goals, and like, at least for me and how I'm seeing like state level, is like, how can we really unify our voice and advocacy so we can make some policy changes that help and uplift survivors.
One thing I would add is we name our hopes, worries, and curiosities involving each project. So it gives us a moment to kind of, like I said, world build in a way. Like, if this were me, and we could put ourselves in the shoes of all the people involved, what is the benefit in that? So we're always kind of doing that internal work to visualize, how do we want to see the world. So through each small project, each small endeavor, we're really trying to make real change and visualize, well, how could this be better? So we put our hearts and minds, bodies, and souls into this work in a way. Like, it could be very intense. So it's a labor of love. Like, we really want to see real change. So I think one of the things is keeping in mind all of the needs of the people involved, and then hopefully in time we're able to collaborate and build on those stories of, how am I experiencing this system differently? Like, what is the real impact, the real world impact in my daily interactions with this system? And how is it influencing me? Naming those curiosities, naming those worries, and naming like what we hope to gain from these things always like grounds us into what we're doing. Like, throughout those busy weeks, like, we could always go back to that palette and say, well, this was actually our goal. And did we get there? And we always aim high. We always aim high, and we're always trying to push barriers. We always trying to push the barrier. So it's all about the world building for us. Like, we really want to see systems change. So we're always committed to thinking big.
Yeah. I'm thinking too about, we hope that this being Ohio specific data will have a local impact on survivors, but also their loved ones. We hear so many folks in rural areas and urban areas across Ohio continue to hear from their community members, their loved ones, this false belief that sexual violence doesn't happen here. And so to have Ohio and regional specific data where survivors can see themselves and communities can see truly the prevalence in a wider array, right? We're still working on collecting more data in a more holistic way, but that feels so important to me. One, so it's interrupting a continued culture of silence, so folks can see more of themselves and that they're not alone in this experience feels really validating and needed. And that their disclosure is important regardless if they report it to law enforcement or not.
I feel like I'm getting a little emotional.
Yeah, hopefully Ohio will be the model for other states.
Yes.
Yeah.
You know, when we think about numbers and data, it can feel so, it's almost like people become just a number. But I feel like when I hear a stat like 1 in 3 women or 1 in 5 women, like that doesn't tell me anything. We don't actually know how to solve a problem when you just hear a stat like that. And I feel like this project digging deeper into like, who are these people? What are their identities? Is there a certain setting or community this is affecting more than others? I feel like that's the real way we can actually make change, when we know the who, what, when, where, and why, and not just slapping a 1 in 3 on it and calling it a day. And Deja, you mentioned you saw this RFP and thought, oh, this sounds like a cool opportunity. For me, my capstone, was just a grad school project I needed to do to graduate. And obviously I had, interest in it working at OAESV, but now seeing that my capstone and like this RFP that you applied for like could possibly change the world. Like it's just one of those things where I'm like, when I'm, in my in the grave one day and people are listing off like your list of accomplishments, like we could say something pretty amazing. So I'm dreaming big with this project.
Yeah. I definitely think we should dream big. And when you were speaking, it just made me think about like why it's so important to relationship build when you're doing this work is because like if we really want like deep and in work that's really shows the depth of like what's happening in Ohio, we have to make sure that within the project team we're building relationships. And so like what does it look like for Jen and also like Caitlin, who has been a part of this project as well, to know not only who Ubuntu is, but who I am, like as an individual, who Lex is, right? And so if we are building intentional relationships amongst us as a team, where we're going beyond the surface, right? And just like, okay, here's the scope of work, here's the timeline, this is what we need to do, let's get it done. But actually taking a chance to pause and like get to know each other, it makes the work so much more, I just feel like authentic, genuine, and it translate outward. So like now we're digging deeper with like survivor stories, we're digging deeper with the rape crisis directors, we're digging deeper with state funders and agencies because we took the time to intentionally make sure that the relationship building that we had amongst ourselves was solid before we, went out and started to engage with folks. And I think a lot of times in different projects, that step or that phase is often skipped to go like straight into the work. And it's like, no, relationship building is also a part of the work. What does it look like to build trust? We're dealing with a sensitive topic. We're dealing with real people's stories and real communities that are impacted. And so I think more projects need to be intentional about getting to know the who, what, when, and why, not only for like the context of the project, but the people who are doing the work too. Because if you don't know me, right, and we're doing this work together, how deep does our work really go? And so I just wanted to echo that. I think one of the successes of this project and just the partnership of Ubuntu and OAESV is because we took that intentional time to really get to know each other, whether it was through check-in questions or getting like food recommendations when we traveled to Ohio. But we really wanted to like really get to know each other. So I just wanted to uplift that.
I'm grateful for you all and all of it you have brought and what we continue to do together. And shout out to Ebony.
Yes, Ebony, can't forget Ebony.
Yes, so many names that are part of this amazing project. So I can't thank you three enough for having on this episode today and sharing with our members why data is important and cool and why we're doing this project and I guess what success will look like and what we're envisioning. So thank you so much.
Thank you for having us.
Thank you so much, Deja, Lex, and Jen, for joining us. It's clear that building a survivor-centered data system isn't just about compliance or numbers. It's about building a system that truly reflects the lives, needs, and strengths of survivors and advocates across Ohio. And to our listeners, we'll keep you updated as this project progresses. And as always, thank you for the work you do every day. Until next time, take care and keep advocating. Thanks for listening to Teal Talk. We hope you enjoyed our deep dive into intersectional issues affecting survivors in Ohio. If you like what you heard, subscribe and leave us a 5-star rating and review, recommend us to a friend, and follow us on Instagram and Facebook at OAESV and Twitter at Ohio Alliance ESV. If you'd like to learn more about us and the services we offer, sign up for our email list, or read a transcript of this episode, visit oaesv.org.
Want to share a comment or ask a question for a future episode? Just click on the link in the show notes to leave us a voicemail. And remember, we're here to help. Feel free to call our resource line at 888-886-8388 888 during regular business hours, or the Ohio Sexual Violence Helpline 24/7 at 844-644-6435. See you next time.